Hello, everyone. Thanks for tuning in. Eastern America here, and just wanted to tell you about part two of my surgery. Um, I had kidney stones. I've got one that apparently is 7 millimeters, and it's up there. It's up in the kidney, and it's another one in the aorta. And I know that a lot of this is confusing because today I found out that there's a 3 millimeter. The 3 millimeter I was talking about previously is on the other side, and it's like a cyst. And he said we're going to look at that after I recover from this. I just had surgery yesterday. I just got back home. I'm on painkillers, and also what's the word for it? The um, well, I'll come back to that. Uh, but anyway, it was a rough surgery. I mean, let me tell you, I showed up, and the anesthesia people talked to me first, and they asked if I had anything that came out of my mouth, like teeth. I don't. I have all my regular teeth. So anyway, they talked about putting something down my airway, and I guess that's part of the anesthesia. And so I fell asleep. I guess they put the painkillers in there, and I woke up. It was remarkable because 1 minute I was awake, and next minute I was actually asleep. I guess, and then it was like it was 1:30 in the afternoon, and I remember looking at that clock. It was 1:30, and then all of a sudden I looked at another clock. And it was 4 p.m. So it must. I'm thinking it was right around 2.5 hours surgery, maybe less. 2 hours and 15 minutes. I don't know. I haven't really spoke to the doctor about it. He's a pretty frank doctor, so he's very specific. So trying to get a lot out of him, you won't. He's very technical about everything, which is fine. He's a good doctor, so I'm happy that I had him. So then they got me up to the room, and I know I was dehydrated because they tell you not to eat or drink after midnight, the day of the surgery. And actually, my surgery I thought was going to be around 11 a.m. and when I showed up, they said it was 1 p.m. So I had to wait around. So I hadn't drank any water. They said don't drink any water, nothing. So I hadn't drank anything. So I was kind of dry. Throat was dry, not real dry, but it was pretty dry. And so I went in and did this thing. And so when they brought me out of surgery, I felt like I had to drink water. I know I was still under a little bit, and for some reason I wanted to spend all my time in the restroom sitting down. They had a table, the regular table they bring by your bed for food, and it has all the water. And I really hadn't had any guidance, and I just said to myself, I need to be drinking water to flush my kidneys. I mean, I figured that much. And um, he went in and he chopped it up. He chopped them up with a laser. He blasted them up with a laser. And I'm still going to go back and look at those dimensions on those kidney stones. But really, I'm just trying to help people by sharing my story. So anyway, I've done a lot of research, as you know. I've been thinking about it, especially the day before the surgery. I was like surfing all day long on the internet looking for stuff, research. I come to find out that we should be drinking, like if you're a 200-pound man, you need to divide that by half, and you should be drinking 100 ounces, whatever that is. My math is not great, so just to know. But I did mine. I'm 100 and 180. I think I came up with 60, and so I drink bottled water, and so now I have a when I did the math, that's 3/4 of that gallon right there. But I'll just go ahead and drink a whole gallon of water a day. Just go ahead and be safe, And then there's some references to, depending on hot weather climates, that people should drink 2 gallons of water, or depending on where they are. So there's some interesting concepts on this. But you want to flush your kidneys all day long. Can we do that practically in this entire world with a water shortage, a quality clean water shortage? Maybe not. I don't know, but if we can, let's do it. Let's get everybody taken care of. So anyway, the surgery. I was in the bed, and I had to ask for painkillers because in my case, I believe he went up into the kidney and he chopped up one of those stones. And he used a laser, like I said. And I noticed that, yes, the stent was painful, but to be honest, and it's still a little painful, but it's getting a lot easier. The real pain is in the kidney itself when you are passing the fluid out of your kidney. It's compressing, and it's as it pushes the stuff out, the pain comes in that area. So I guess it's sore, and I guess it's bruised maybe a little bit in there somehow. So I'm on the antibiotics. That's what I was trying to say earlier, antibiotics and also the painkillers. So I'm taking the antibiotics, and I stayed overnight. Normally you can have someone drive you home the same day, but I don't have anybody to drive me, so they let me stay overnight. And I came out of the painkillers. You got to wait like 8 hours before you can drive, so I did all that. I got a lunch out of it, to the point I was leaving. So I'm back home, and I'm on the painkiller, my first painkiller house, thank gosh. And I'm just staying in the house, of course. I'm not going anywhere. And they'd say take them as needed, so that's what I'll be doing. So I just want to give you an overview. He got everything on my left side. That's what he told me. So that just sounds great. And then on the right, apparently it's just a 3 millimeter, but it's still a cyst. Or he did mention the biopsy thing, so hopefully they do a biopsy. But I don't want anyone to go through all this stuff that I'm going through. If you're younger, if you're a lot younger, like maybe 30 something and younger, I would think you're pretty much okay. It's the older people, you start getting into your 40s and late 40s. But, I think the people that carry the water, you see them all the time drinking water. That's really important. Drink water. Coffee, they say that contributes to kidney stones. I would just say 1 cup of coffee, but make sure you drink that gallon of water during the day. And then on the other side, if you're going to mess around with other stuff, make sure you still drink a gallon of water a day. Bottom line, gallon of water every day. I mean, if you can do that. Now you can boil water. You can boil it. You can take it out of the tap. You boil it. And I looked this up, and they say boil it for 1 minute. And in some cases, you can boil it up to 2 minutes if you feel you need. And it means a rolling boil. That boil will be consistent for 1 minute or 2 minutes. So there's your drinking water right there. It is a little time consuming. But if you dedicate 1 day out of the week and you boil like 3 or 4 gallons worth, you have to put water back on there and all that. Go ahead. Whatever you got to do. So things are just getting, we got to take care of ourselves. And this is one that got my attention. Like I said, it seems like most everything is from up here down below your waist. If you can get an X-ray. So anyway, if I've helped anyone, I hope I have. But don't ignore your body. If you're not drinking water, how is your kidneys going to function? Especially if they're trying to process more difficult stuff like coffee, which is kind of hard on the kidneys, and alcohol, and you're not even rinsing out your kidneys with regular water. It doesn't add up. It doesn't make sense. So anyway, I hope everyone has a good weekend, and this is part 2. Part 3, probably I will make a cameo about this again, about how well I'm doing. Hopefully I'll be doing, and that's next week, and I'll probably do it later part of the week, let you know how I'm doing. But I'll be talking about a different topic, so we can move on beyond this stuff. Okay, so anyway, thank you for watching. And by the way, please subscribe, please like, please share with your friends, and also hit that notification bell. Thank you. Have a great day.